49 months to 54 months. Sub-skill: jumps sideways and backwards. Child development methods. 1. The parent demonstrates how to jump to the left, to the right, and backwards. 2. The parent stands facing the child, holds the child's hands, and then says, "Jump to the left, jump to the right," or "jump backwards," while supporting the child's hand to guide in the correct direction. 3. Encourage the child to jump safely. 4. The parent should be careful during jumping activities. Sub-skill: put an 8-piece jigsaw puzzle together to make a picture. 2. An 8-piece jigsaw puzzle. Child development methods. 1. The parent lays a 6-piece jigsaw puzzle in front of the child and asks the child to look at it. 2. Separate the 6 pieces by widening the gaps between the pieces and then ask the child to help by putting them back together. 3. Separate the jigsaw puzzle by swapping pieces from top to bottom and ask the child to put them back together. 4. Separate the jigsaw puzzle pieces by swapping pieces from left to right and then ask the child to help put them back together. 5. Increase the difficulty by mixing up all the pieces and then help the child put them back as a picture. If the child starts to do it, let him or her continue independently. 6. If the child can do a 6-piece jigsaw puzzle, change to an 8-piece jigsaw puzzle. Alternative materials: picture or cartoon cut into 8 pieces. Sub-skill chooses pictures depicting daytime and nighttime. 2. Pictures of 1. Daytime, 2. Nighttime. Child development methods. 1. Have 2 pictures depicting daytime and nighttime and explain to the child about each one. 2. Instruct the child to point to each picture. If the child is incorrect, use the hand-on-hand method and name them again until he or she points correctly. Assistance can then be reduced until the child does it independently. 3. Encourage the child to learn daytime and nighttime from real-life situations. Alternative materials: real-life situations, surroundings, pictures depicting day or nighttime. Sub-skill: answers appropriately when asked. If you feel hot or sick or hungry, what can you do? Child development methods. 1. The parent trains the child in daily activities. When the child expresses feelings of being hungry, hot, or having a headache, the parent asks, "What can you do?" to prompt the child to think of a situation or solution. 2. If the child cannot answer, the parent should explain. For example, if you are thirsty, you can drink water. If you feel hot, you can take a cool bath. Or if you have a headache, you can take medicine. 3. Encourage the child to answer about other situations. For example, how can you take care of other people's things? What would you do if a friend fell down? What would you do if there was litter on the ground? If the child can't answer, teach him or her about a correct or appropriate solution. Sub-skill: cleans himself or herself after using the toilet. Child development methods. 1. Practice washing the child's bottom by getting the child's dominant hand to hold the water hose or the water dipping bowl. To clean his or her bottom, hold the other hand to wipe the bottom until clean. 2. Dip the bowl and pour water into the toilet, or push the button to flush and clean the toilet. 3. Show the child how to wipe his or her bottom until dry, and wash hands by holding the child's hands for every step until the child is able to do it independently.